What plan type should I select? Most plans offered in the marketplace are going to be either HMOs, PPOs, point of service plans, or health savings accounts, which could be any one of these types of plans. So the first plan we want to talk about is the HMO. The HMO offers you one network of doctors and specialists and hospitals. Many of these plans allow you to go to any doctor within the network, while others require you to get a referral. But generally speaking, HMOs are going to be less expensive than PPOs or point of service plans. The second plan type we want to talk about is the PPO, or Preferred Provider Organization. This type of plan has two different networks of providers. You have the in-network side, which would be comprised of your doctor, the specialists, hospitals, and facilities that you would generally go to. And then there's another network alongside of that that's considered out-of-network. That would be the doctors, hospitals, and facilities that you normally would not go to. In-network, you have smaller deductibles than you do in the out-of-network. The difference between in-network and out-of-network is pretty simple. In-network would be your doctor and the hospitals and facilities that you would generally go to. The out-of-network benefit schedule would be those doctors, facilities, and hospitals that you ordinarily would not go to unless you really had to. So the biggest difference between the two is in-network, you have smaller deductibles, co-pays, and co-insurance than what you do out of network. But always remember, if you go out of network, you will always have a whole new set of deductibles, co-insurances, and co-pays that are applicable to the service you'll be getting. The nice thing about PPOs is you do have a much larger network of providers to select from. So this plan would be more expensive than an HMO. Last of all, a point of service plan. This type of plan really is kind of a hybrid between an HMO and a PPO plan. So you have your in-network and you have out-of-network. For the most part, you do have to go to your in-network doctor, and if you do want to see an out-of-network doctor or hospital, you would have to get an actual referral from your doctor. And these types of plans are more expensive than the PPOs or the HMOs. The last type of plan we want to talk about is health savings account. An HSA can be less expensive than any of the other three plans. What sets HSAs apart is that you must, first of all, have an HSA eligible high deductible plan. And this is determined by the federal government. But once you go onto this type of plan, you have no coverage whatsoever until your deductible has been met, with only one exception, and that is for preventative services. And most of the time, this will be the most affordable plan type that you can pick from all of these plans. To learn more about your health insurance needs, visit us on myfamilyhealthinsurance.com.